Assalamu alaikum. This is Dr. Ghufran Babar, and you are watching my YouTube channel. Today, I have started a series of lectures, High Yield Pediatrics, which will cover the common pediatric topics which are covered on Step 2 CK and in Step 3 in general. So please subscribe to my channel and follow my upcoming lectures. Today's High Yield Pediatrics lecture is on growth. Growth is the single most important indicator of well-beingness in a child. So that is a pearl that you need to remember. So always follow the growth curves. So CDC approved growth charts for height, weight, BMI, head circumference all help you for well child care and track the growth charts. So in general, most of the babies are at 50th percentile at birth, which is about 21 inches or 50 centimeters. First year, most of these children gain half of that or 25 centimeters or 11.5 to 12 inches. Second year, half of that, which is 5.5 inches or 11 to 12 centimeters. And then from there onwards, they grow at a rate of about 2 to 3 inches per year until they hit the puberty. For girls around 14, for girls around 12, for boys around 14, they go through the pubertal growth spurt in which they grow at 4 to 5 inches per year for 2 to 3 years, depending upon the family target height. How do you calculate the mid-parental height? Add the heights of the parents plus 5 inches. So if mom is 5'2" and dad is 5'7", add 5 inches to mom's height for a boy. So she becomes 5'7", and which is about 67 inches. So dad is also 67 inches. 67 plus 67 divided by 2 is 67. So 67 inches is their mid-parental height for a boy. For a girl, you subtract 5 inches from dad's height. So dad is 67 inches or 5'7". Minus 5 inches becomes 62 inches. 62 plus 62 inches divided by 2 is the mean height, which is 62 inches or 5'2". So that's how you will calculate the mid-parental height. But most important thing is the growth charts. Just follow the growth for well child care. As far as the weight is concerned, most of the babies at birth are 3.5 kgs. In first 2 weeks, they lose up to 10% of their body weight and regain it by 2 weeks of life. So 3.5 kilograms is their mean weight, and they lose 10% of weight by 1 week, and by second week they have already regained that weight. And until the 3 months of life, from 2 weeks, they gain up to 30 grams per day. From 3 to 6 months, 20 grams per day. They double their birth weight between 4 to 6 months of age. And by 12 months, they have tripled their birth weight. By 2 years, they have quadrupled their birth weight. And from 2 years until puberty, kids gain 2 kilograms per year. So 2 inches and 2 years. So remember, 2 inches per year after age 2, 2 kilograms per year after age 2 is the approximate amount of height and weight gain in children. As far as the head circumference goes, most of the kids, at birth, they are close to 35 centimeters. And they gain 0.5 centimeters per week for 2 months. Then 2 to 6 months, 0.25 centimeters. By 12 months, they have already gained 12 centimeters in head circumference. So 47 centimeters is the head circumference by the age of 1 year. And the brain growth has to be monitored because if it is small, the microcephaly, the brain is not growing, then there may be some serious or some disorder going on. Please watch my video on the growth. Those will be useful for assessment of short stature and indications of growth hormone therapy. As far as the weight, just like you water the plant, it grows. If the child does not gain weight, the child will not grow well. So monitoring of growth charts, both for height and weight, are very important in well child care in pediatrics. As far as the lack of weight gain is concerned, the failure to thrive, what happens is that when you look at the growth charts, first the weight centiles fall and then the height centiles follow them. So kids who are on ADHD medications, they will not have enough calories because their appetite is suppressed, like drugs like Adderall. So first the weight centiles, they start falling and the height centiles will follow them. So this is the example of failure to thrive. So someone who is gaining weight excessively should have good height centiles as well, just like physiologic growth in kids who are obese or overweight. In kids like Cushing syndrome, they'll be gaining weight, but their growth charts will be flattening because excess steroids, they downregulate or they affect on the growth hormone receptors, so they don't grow well. So if you see on a growth chart, someone is growing well, but someone is gaining weight but not growing well, then could be either Cushing syndrome or hypothyroidism. People who are not gaining weight, you have to remember celiac disease, which is the failure to thrive, one of the causes for, say, failure to thrive. So let's jump onto the causes of failure to thrive. Either their calories are not coming in, so lack of calories. In younger kids, you worry about kwashiorkor or marasmus. So those are the disorders in which those kids don't grow well. In kwashiorkor, they're really swollen because of lack of protein as well. Marasmus, they're really wasted because of total protein calorie malnutrition. The defect could be either parental knowledge, they are not giving enough protein, could be formula dilution. So they could be a vignette in which they will explain that mom is diluting the formula and the kid is not gaining weight. What could be the cause? There'll be a catch point. So you remember formula dilution is very common. Neglect, and mom is depressed, she will be neglecting the child as well. The child with developmental disabilities, oromotor dysfunction, oral aversion. In some kids, they are picky, they don't eat well. And then chronic vomiting, signs like pyloric stenosis could be early on, in which they'll not be gaining weight. Later on, GI disorders could be the cause. And in teenage years, they could be anorexia nervosa or eating disorder, in which they would not be gaining weight, or have bulimia nervosa, in which they will be inducing vomiting. Those are old kids with failure to thrive or lack of weight gain or eating disorder. Excessive, the second category of failure to thrive, when your caloric requirement increases, like insulin resistance in IUGR. In babies who are very small at birth, they need a lot of calories to gain on the lost height. So 90% of kids who are born small or small for gestational age, they gain the lost weight by age 2 to 3 years. And if their nutrition is not there, they will continue to be small. Chronic illnesses like chronic heart disease, cyanotic heart disease, lung diseases, aspiration syndromes, chronic aspirations, cystic fibrosis, kidney diseases will lead to lack of weight gain. and kids who have had torch infections in which they are developmentally delayed, they're resistant, they're small for gestational age, they're resistant to growth hormone, and they may not gain weight. They may have cleft lip, palate, other problems with swallowing, so they'll not be able to gain weight. Then the third group of disorders is absorption of calories. So absorption of calories could be suboptimal, which could be in malabsorption syndromes, cystic fibrosis, celiac disease, especially once the gluten is introduced. Basically, celiac disease is gluten enteropathy, in which kids are allergic to gluten, food protein intolerance, other milk protein intolerance, lactose intolerance. All those disorders will lead to lack of weight gain, and due to that the growth will not happen as well. So this is the high yield points in failure to thrive, or short stature and normal growth in kids. Please continue to follow my high yield pediatrics videos. Subscribe to my channel, share these videos, and please give me your suggestions in the comment section if you want videos on a specific topic. Best of luck with your step 2 CK or step 3 preparation. May Allah and God help us all. Sallallahu alaihi wa alihi wasallam. Best of luck. Assalamu alaikum.